In this podcast episode, Andrew Huberman interviews Jeff Cavaliere, a physical therapist and certified strength and conditioning specialist, renowned for his expertise in training for strength, muscle size, health, and longevity. Their conversation spans a wide range of topics related to maintaining physical function, preventing injuries, and optimizing performance as one ages. They delve into both the foundational multi-joint exercises as well as critical yet often overlooked small but essential movements that support longevity, posture, injury resilience, and overall quality of life. Jeff emphasizes that longevity is fundamentally about maintaining function as we age, not merely accumulating years, but preserving the quality of those years through sustained mobility, strength, and pain-free movement. All muscles serve vital functions, and many of the often neglected smaller muscles, particularly those that stabilize key joints and areas like the lower back, hips, and shoulders, are trainable and, hence, correctable. One major example discussed is the glute medius muscle, which controls hip and pelvic positioning. Dysfunction or spasm in this muscle often contributes to low back pain because pelvic misalignment forces the lumbar spine to adapt, often negatively. Simple yet effective exercises such as leg raises targeting the glute medius can alleviate pain by resolving spasm. Nonetheless, Jeff stresses that pain relief from such fixes reveals underlying weaknesses that require strengthening to prevent recurrence, highlighting the need to progress from pain management to comprehensive preventative strengthening. For preserving lower back health while engaging in resistance training, such as squats and deadlifts, Jeff recommends exercises that focus on both back extensor muscles and the smaller hip stabilizers. Reverse hypers are singled out as highly beneficial, offering safe, accessible glute activation that transfers load away from the lower back. They can be performed even on a bed at home if a machine is unavailable. Supplementary exercises include hip bumps or lateral leg slides against a wall to strengthen the glute medius, and exercises using resistance bands to train hip rotation and pelvic control. Jeff outlines how single-leg stance challenges the glute medius and that weaknesses here manifest as pelvis drop or Trendelenburg gait, which places strain on the low back. He also describes inventive approaches to challenge hip stability in more functional contexts, such as walking with a weight suspended between the legs to minimize sway, or performing suitcase lunges with a weight held on the opposite side to create instability the glute medius must resist. These movements integrate multiple planes, providing strength and stability gains applicable to daily activities and athletic pursuits. Jeff advocates for conducting these smaller muscle and stability exercises separately from main resistance training workouts rather than as a mere afterthought. Performing brief, dedicated routines several times a week, either on rest days or distinct sessions, allows focus and prevents compromising the quality of larger compound lifts. If these exercises are done on training days, placing them after larger movements can pre-fatigue dominant muscles that tend to compensate and overshadow smaller, weaker muscles. This strategy enhances recruiting and strengthening these smaller muscles more effectively. Beyond physical benefits, these small exercises promote balance, coordination, and pain-free function over decades, helping individuals to avoid chronic breakdowns from cumulative microtrauma experienced through youth and adulthood. Jeff shares an accessible daily old man test, which involves standing on one leg to put on socks and shoes without sitting down. This simple task assesses balance, lower back muscle control, ankle mobility, and hip strength simultaneously. Though small and easy to overlook, failing this test signals deficits predictive of declining function and injury risk. Another longevity indicator discussed is the side plank with top leg elevation, which directly measures lateral hip strength and glute medius control. These assessments are trainable, and improvement in these areas strongly correlates with functional longevity and reduced injury prevalence. Importantly, these tests are easy to perform at home and do not require equipment, making them practical tools for ongoing self-monitoring. Athletes often suffer from asymmetries and imbalances caused by repetitive unilateral movements inherent in sports such as baseball or golf. Jeff points out that while early strength training philosophies emphasized replicating specific sport motions, this approach results in overuse and chronic injury. Modern recommendations advocate for general bilateral strength development focused on core lifts to create an evenly balanced physique. This approach improves overall movement quality and power production across various planes of motion without exacerbating sport-specific imbalances. Skill work should remain separate and targeted. Special considerations arise when an athlete's sport requires hypermobilization, such as pitchers with hypermobile throwing shoulders. In such cases, minimizing mobility work on the dominant side is advised to avoid excessive laxity. Yet, foundational strength and stability should be preserved bilaterally. Jeff explains that athletes and functionally fit individuals naturally adopt staggered and sometimes wider stances to optimize stability, whether during pressing, curling, or lunging movements. For instance, leaning slightly toward the working arm during a dumbbell curl stabilizes the shoulder girdle and torso, allowing a more efficient contraction. In lunges, taking a wider step backward while twisting, screwing down, the torso toward the leading leg enhances pelvic stability and reduces wobbling. This co-contraction of hip muscles supports safer and more powerful force generation. Understanding and incorporating these subtle postural and positioning strategies into workouts improves movement quality and lowers injury risk. Elbow pain, particularly on the inner side, medial epicondyle area, can often arise not from the elbow itself, but from excessive strain on specific finger tendons involved in gripping. Jeff highlights that relying too much on the ring and pinky fingers to grip a bar or dumbbell, especially when the grip is positioned at the fingertips rather than deeper in the palm, overloads the associated muscles and tendons, leading to pain and inflammation. Adjusting hand position so the knuckles are over the bar, allowing the load to rest more in the meat of the palm, redistributes the stress safely. He also discusses the hook grip for lat pull-downs or other pulling exercises that engage stronger fingers preferentially, but notes this grip may aggravate those prone to elbow tendinopathy. Jeff and Andrew discuss at length the risk associated with chronically internally rotated shoulders, a common postural problem exacerbated by modern lifestyle behaviors like texting and sitting. Internal rotation dominance shortens anterior shoulder structures and narrows joint space, promoting impingement and inflammation during overhead activities. This can cause pain and predispose individuals to rotator cuff injuries due to compression of tendons and bursae. Strengthening and activating the external rotator cuff muscles, is critical to maintain proper humeral head position in the socket, improving joint centration and spacing during arm elevation. This reduces pinching and subsequent tissue damage. Jeff recommends banded external rotation exercises, keeping the elbow close to the torso to avoid compensation by the deltoid muscle. These exercises can be used as warm-ups or dedicated rehab-prehab work to maintain shoulder health and posture. Neck training, often overlooked, plays a crucial role in postural support, injury prevention, and strength balance. Jeff underscores his personal experience with neck resilience following a car accident and the wider benefits on pressing and pulling exercises. He describes a simple, equipment-minimal approach using light-weighted plates wrapped in a towel and performed lying in 4 directions to strengthen neck flexors, extensors, and lateral muscles. Women seeking a strong yet elegant neck are unlikely to experience significant thickening due to the smaller hypertrophy potential in neck muscles compared to men and the typical absence of trap overdevelopment. Strengthening the neck improves overall upper body proportion, supports spine stability, and may reduce injury severity in traumatic events. Jeff acknowledges the importance of cardiovascular health, but admits to a personal time constraint that limits his cardio volume. He prefers modalities such as stationary cycling with resistance and jump rope, which provide conditioning with minimal joint impact. These exercises contribute to cardiovascular fitness while being gentler on joints, which is critical given his own knee limitations. Regarding fat loss and aerobic exercise, Jeff supports the principle that the best cardio is the one that the individual will consistently do. He highlights that steady-state exercise at moderate effort, Zone 2, yields more sustained calorie burn than brief high-intensity bursts that cannot be maintained for long durations. Nonetheless, proper nutrition is the primary driver of fat loss. Exercise complements but cannot compensate for poor dietary habits. Jeff shares his nutritional approach centered on sustainability and performance. He emphasizes prioritizing protein, making it approximately one-third of plate volume to support muscle maintenance and satiety. Vegetables, fibrous carbs, and starchy carbs are balanced for energy without eliminating carbohydrates, which he finds critical for long-term adherence. He warns against excess caloric intake from healthy fats like olive oil and avocado, urging mindful portion control despite their health benefits. Jeff discourages extreme dietary restrictions that compromise sustainability, highlighting that moderate, flexible nutrition, allowing occasional treats without guilt, is conducive to consistent results. Understanding macronutrient content and practicing flexible food swaps cultivates nutritional freedom and long-term success. The conversation reveals that foot intrinsic muscles often receive little dedicated training despite their significance in supporting arches and overall limb alignment. Jeff confesses he wishes he had trained his feet earlier, citing his own flat feet and resulting knee issues. Simple exercises such as towel scrunches with the toes and barefoot single-leg balance drills can improve arch strength and foot stability. Strengthening foot musculature helps restore natural alignment, reduces unnatural tibial torque, and decreases strain on knees, hips, and back. Foot orthotics are described as external braces that assist alignment but do not directly address intrinsic muscle weaknesses. Jeff addresses common questions about training parameters. He generally performs 2 or 3 warm-up sets for the first exercise, emphasizing quality over excessive warm-up volume, as the workout itself prepares the body for subsequent exercises. He prefers training to failure on isolation or hypertrophy-focused exercises, but stops short of failure on complex multi-joint lifts like squats or deadlifts, where form degradation has higher injury risk. Work sets per muscle group vary. Smaller muscles like biceps may receive fewer sets with varied exercises to stimulate different heads, while larger muscles such as quads or lats receive more volume. Jeff discusses balancing volume and intensity, noting that while training to failure is effective for growth, it may be unsustainable over long periods or with complex lifts. Incremental progress can also come from increased volume of lower intensity work. He acknowledges differences in recovery capacity, endorses training muscle groups hard once per week for himself, but considers indirect work within the program, e.g., back training involving biceps, as meaningful stimulus. In real-world training, Jeff describes how familial and work priorities influence workout structure. On nights when energy is low, he divides workouts into 2 sessions, spaced days apart, completing half a workout one night and the remainder later. Though he previously avoided splitting the split, he recognizes that this approach yields better mental readiness, higher workout quality per session, and fits his current lifestyle demands while maintaining progression. Extending training cycles beyond 7 days allows for adequate recovery and consistent effort with less risk of burnout. Prioritizing family time and managing training around life realities exemplifies sustainable fitness practice.